right, we'll probably wait for some people to trickle in, but I think we can get started first. We have a very full agenda today. We have 13 presenters that are going to talk to us about their research. So the format is a 5-minute sort of lightning talk. We will save Q&As for after the session. We'll get through all 13 before we start Q&A. For Q&A, you can use Slido if you would like to ask your questions. Just be sure to direct your questions to a specific person. If you scan your tag, you can access Slido through there. Just look for your room and you should be able to access that platform. I think we can start. Without further ado, let me call Mr. Alamgir Haider to give his talk.
Thank you, organizer and ladies and gentlemen. This is Alamgir Haider from Bangladesh. I'm working with Pathfinder International and the project manager, Women-led Climate Resilience Project. Under this project, we have assessed 297 facilities in terms of climate change and disaster preparedness. So I'm going to show you the findings. This is due to time shortage, I will go with the very fundamental things that we have identified. So, you know, the Bangladesh is a highly climatic vulnerable country, and each year she has to face cyclone, flood, river erosion, drought, saline intrusion, so different type of slow onset and rapid onset hazards. And we have conducted the health facility assessment research in 4 districts, around 15 upajalas. So, and we have adopted the World Health Organization's checklist. That is, based on that, we have assessed the facilities focusing on the flood. So here, the major things are identified that we have. Each facility has to serve around 6,000 population, which is really overburdened to the facility providers also. And around 50% health facilities are closed during the flood we have experienced last 2022. And it's about the 122 years record-breaking flood during this period. And we found almost 52% facilities are even closed and could not serve to the population. And here is the status of toilet functional or not functional, both in the community clinic and also the union level health facility management clinics. 78% facilities has power to serve, but the others struggling to provide service in terms of power management. 37% health facility don't have running water during that time, and 95 community clinics of 2016 reported that don't have running water supply also. 26% only have fully cleaned, and 13% facilities were outside were fully cleaned only. And 77% facility have citizens chartered. 56% facility reproductive health service information displayed properly, and 44% facility IC materials displayed properly. In terms of emergency preparedness, only 2% facilities have the preparedness plan, and 2 months for 2 months supply essential commodities. So they have 30% reported that they have. So these are the findings from the study. For disaster mitigation planning, only 1% have rainwater harvesting system, has post crisis recovery plan only 2%, and 32% reported that they have shading device. So these are the basic findings we have identified, and there are also we have validated these findings with the respective government officials and other NGOs. They have come some with some suggestion and recommendation that we need to be considered to ensure the service for the dwellers at the community level. Uh, 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 the things are like strengthening the disaster management committees, contingency planning, and proper early warning system, and budgeting for the contingency plan. So these are the overall findings from our research. Thank you.